Good morning, everyone. Thank you for joining us here today. We're here to discuss community care behavioral health as a managed care provider in the state of Pennsylvania. It's an analysis with accompanying recommendations for driving positive healthcare results moving forward. So let me just start with a very brief overview of the organization. As we know, CCBH, Community Care Behavioral Health, is a nonprofit managed care organization within the state of Pennsylvania that facilitates Medicaid funding for mental health and behavioral health services, specifically participating with Pennsylvania's Behavioral Health Choices program, where we are one of 5 managed care providers in the state. And we are the largest managed care provider within the state, covering 37 of the 67 counties and spanning over 11 contracts specific to either individual counties or county joinders. Community care is responsible for these 3 strategic initiatives as a managed care organization. It is our responsibility to ensure that there is access to services, that these services are of the highest quality, and that services provided are cost efficient. And just briefly discussing each of these strategic initiatives. As the largest provider in Pennsylvania, Community Care Behavioral Health has grown to be the largest provider through the use of access tools such as a fully functioning website that's user-friendly, outreach programs where the deployment of resources to identify patient needs and address the patient needs such as information, presentations, on-site support, as well as a 24/7 phone consultation line where patients and consumers, stakeholders, providers, anyone who has a question or concern can reach us at any time of the day. With quality, we have a utilization of manuals that detail expectations specifically to billing, record keeping, program standards, clinical guidelines, and consumer and stakeholder expectations, with the purpose of soliciting feedback from consumers and stakeholders and ensuring their satisfaction, measuring their satisfaction. We also have a siloed program within CCBH, which is our quality improvement department, which is focused on nothing but performance quality improvement efforts. So taking all of that information, collecting all of that data, setting those expectations, that is not something that's done as an entire company. We have a group of subject matter experts that's able to do that for us and manage it ongoing. And then cost efficiency, our fraud, waste, and abuse department. Of course, we all know what fraud, waste, and abuse is in healthcare, and our charge to ensure that we mitigate fraud, waste, and abuse. We have a separate group of subject matter experts that manage fraud, waste, and abuse claims, fraud, waste, and abuse investigations, and set those fraud, waste, and abuse expectations for our providers. The organizational structure of community care is pretty straightforward. We are contracted, so we every 4 to 5 years are required to respond to RFPs, which is a request for proposal presented by each of the contracting entities. And our job is to ensure that we will provide the most access, the best quality, and the most cost-effective way. And I think we have been able to do that fairly well. Again, 11 contracts serving over half of the counties in Pennsylvania at this point, and only doing that in the last 20 years, which is pretty impressive. And it's thanks to our infrastructure. We have a robust executive leadership team with our CEO, Chief Information Officer, Chief Financial Officer, Chief Operating Officer, and Chief Medical Officer. And then titrating that down into divisional and contractual support. Our divisional support, again, I just spoke about quality, compliance, fraud, waste, and abuse. And then contractually, each contract is managed by a regional director, a clinical director, and then subsequent case managers that are the boots on the ground for those individual contracts. So there are some challenges. There's always going to be challenges in our analysis of community care behavioral health. We've identified, back to our strategic initiatives of access, quality, and cost efficiency. Just some, and I believe these are industry standard challenges, but nonetheless, they are challenges. Challenges with access, resources. Community Care's executive team is based out of Pittsburgh, Pennsylvania, which is in Allegheny County. And the furthest contract away is in Luzerne and Wayne County, which is over 300 miles. So there is a challenge there with the barrier of deploying resources as needed, in addition to the fact that Pennsylvania is very rural. With metropolitan counties sprinkled in. So you have Allegheny County, you've got Dauphin County, you've got Philadelphia County, you have Erie County. Those are the predominantly more metropolitan counties. Everything in between is very, very rural. And oftentimes the resources for programs are dedicated to the most metropolitan areas, even though the need might still be there for the rural counties. So we need to keep an eye on that. Quality challenges, data collection, just ensuring providers know what data we want, what data we need. And that's on us to ensure that there's a clear setting of expectations. However, the old saying is, garbage in, garbage out. Our data and outcome collection and our ability to evaluate and measure is only as good as the information that we're gathering from our providers. So there's always going to be a challenge in collecting that data and then effectively sorting through it and being able to measure and use it in a meaningful way. And then with cost efficiency, there are challenges. Next slide. We have a ongoing challenge with the transition to value-based purchasing in the state of Pennsylvania. The Office of Mental Health and Substance Abuse has dictated to all managed care providers working in the Pennsylvania Behavioral Health Choices Program that by the year 2020, 20% of our Medicaid-funded programs must be value-based, which is a challenge because we have to first identify which programs we think should be value-based, and then we have to provide the education and training to providers, get their buy-in, and then make sure that there is an opportunity for those providers to be financially viable as we transition from a fee-for-service world or a world where we're focusing more on the quantity of services rather than the quality of services. So talking about value-based purchasing and shared risk, and again, the Pennsylvania Office of Mental Health and Substance Abuse Services indicated that this is a trend nationally that they would like us to expedite here in the state. And after 2020, the goals will continue to exponentially increase, where we will eventually be fully transitioned into a value-based purchasing arrangement with each of our contracted behavioral health providers. So as such, we have to make sure that we're aware and we understand what it means. So looking at a variety of different performance measures and value-based purchasing arrangements, two stand out, pay for performance and shared risk. Pay for performance is a model where we would contract with a provider and their reimbursement is dependent on the outcomes of the service. So it's definitely a shift away from quantity and into quality, which we are hoping, and evidence proves that if the quality of the service is high, then the outcomes of the service are better. And then with shared risk, it's the same. Pay for performance is already a shared risk model, but there's also an additional model, such as public health, where we as a managed care organization can partner with a provider and hone in on a specific segmentation of the behavioral health population. So for example, we can enter into a shared risk model where we work together with providers to address the autism spectrum disorder population and identify their needs, set up a process for addressing those needs, one where it is a shared risk where we as the provider are risking the increase or enhanced reimbursement to address that need in that population. And then the shared risk on the provider is that they're willing to say that, yes, we will only be paid at that higher rate if we can deliver on what it is that you're asking us to do, which is essentially kind of what pay for performance alludes to. So those are some examples of what we need to make sure we pay attention to in the future with value-based purchasing. And that kind of segues right into, our recommendations, of which we have two broad recommendations that I will drill down on here. The first being, aligning organizational structure to enhance customer-focused results. We need to maximize our resources. We need to implement technology to support access for those counties that are further away from us, for example, Wayne County. So we need to use an electronic health record to share information across those counties. We need to implement telehealth to increase access and utilize our resources for case consultation. We also need to ensure that we are using data to measure the needs of rural counties. So maximizing our resources, making sure that we're not using resources unnecessarily in those metropolitan counties where it might be going really well, but in a rural county, they may be struggling. We should be able to deploy those resources back to those counties, and we need to make those decisions using data. We need to build quality measures that align with HEDIS, the Healthcare Effectiveness Data Information Set. This is, the HEDIS measures are a standard across the nation. And specifically in healthcare, this is the foundation of quality and outcome-driven decision-making. And we need to make sure that our outcomes are in alignment with HEDIS and that they complement HEDIS. And that in every case we can, enhance HEDIS so that we can stand out as a leader in this new world of evidence-based decision-making. And then we just need to embrace value-based purchasing. We need to find a way to ensure that that expectation from the state is effectively communicated to providers, and that we are working with providers to problem solve and make it the best partnership possible, knowing that there are going to be some roadblocks and barriers and bumps along the way, but being willing to take the risk and get that model of value-based purchasing up and running. Because this is going to be the standard moving forward. The healthcare industry is shifting into an evidence-based mindset where we're going to be focusing on the experience of the service rather than the quantity and even the quality, which closely ties to experience, but it's going to be about the patient's experience. And the only way to get there is to make sure that we are managing it through an evidence-based process such as value-based purchasing. Our second recommendation is to implement evidence-based strategies that develop organizational culture. So specifically, quality versus quantity. I just talked a lot about the value-based purchasing effort and the patient experience. And this is just reiterating that. We need to make sure that we have that ability to focus on the things that matter to the patient. We also need to make sure that we're agile. We need to have the ability to be nimble enough to respond to patient needs and or new opportunities without having to start over or set up an entire team of people from scratch. So to do that, we would want to make sure that we have subject matter experts that are trained and ready to go when it comes time to address patient needs or when it comes time to respond to opportunities, which happen all the time. There's a need that pops up constantly. Opioid epidemic in Pennsylvania is a great example. So we need to make sure we have subject matter experts that are ready to go at a moment's notice. We also need to make sure that we are innovative. Again, the electronic health record, the ability to share data across systems, patient information, the use of telehealth, and then also the use of evidence-based practices that are continuously coming. For example, from the California Clearinghouse, there's a litany of children's services that are now evidence-based, which is, they've been proven to work. They've had a study done to ensure that everything is going the way it needs to. So we need to utilize those services. And we also need to make sure that we're responsive. And again, that goes back to seeking feedback from patients and stakeholders and using that feedback in a meaningful and positive way. So in conclusion, community care, as long as we can make sure that evidence-based decision-making is paramount moving forward, as long as we are focusing on quality versus quantity, and we are driving ourselves to be innovative, agile, and responsive to patient needs and new opportunities, we should be prime set for driving our positive healthcare results and being a leader in the industry moving forward. Thank you.